of the important segments of our community that will be affected by Medicaid expansion or non-expansion is our hospitals. We have with us this evening Reverend John Peterson, who is chairman of the Augusta Health Board of Directors. Mr. Peterson, how will this issue affect those who deliver health care for us?
As Dave indicated, a lot has changed in the space of a few days. But what has not changed is that there still is no plan in place for expansion of coverage. And there are still a host of folks who are our neighbors and fellow citizens who have no coverage for their health care needs. And what has not changed is that there still is a House of Delegates which remains unmoved and unmoving on this issue. There are some folks who love the Affordable Care Act and some people who don't like it at all. But the reality is it's the law of the land. Hospitals and patients in Virginia have to live within the reality of the law. We can't simply choose to disregard it. Therefore, it's in all of our best interests to find a solution that makes the law as workable as possible for as many people as possible, for the patients and for those who serve them. With regard to Augusta Health, many of you have had experiences there along the way. What you may not know behind the scenes in terms of the impact of the Affordable Care Act is that $300 million in annual payments to Virginia hospitals were eliminated under the Affordable Care Act, including disproportionate share hospital payments for treating the uninsured and cuts to Medicare reimbursement rates. That was to be offset by the Medicaid expansion within states, so that the cuts that we received would provide some flow of income to offset those along the way, and in order to help those folks who otherwise would have no means to pay. Augusta Health provided about $25 million in uncompensated care last year, and an additional almost $5 million in community benefits related to care, things like free tests for free clinic patients, community screenings, subsidies for mental and behavioral health services, and other community health activities. If Medicaid expansion doesn't go through, or something akin to it, the hospital is going to have a difficult time maintaining that level of support for free clinics and other charitable care organizations in our area. Without Medicaid expansion, we're going to be forced to take a look at how it is that we can remain community-owned and independent in order to meet the needs of folks in the community and expand those as the needs expand. We've been blessed to be community-owned and independent at a time when other hospitals have had to merge with health systems. We're one of 5 that are left within the state. Many of the others have ended up merging with larger systems because of the financial pressures that they had to face. We have to absorb these cuts without the offsetting Medicaid expansion. Then we'll have to evaluate how it is that we remain financially viable going into the future. We'll have to evaluate the service lines that we have that lose money but are important to have within a community. We'll have to take a look at whether we can maintain our low fee structure, which is currently one of the lowest in the state of Virginia. And we'll have to take a look at whether we can expand services, which always take a ramp up in order to even break even, because we have to be sure that we can be viable into the future. Those are painful choices that we shouldn't have to make when the resources are available but are being sent on to Washington without coming back to Virginia when we have the very means to bring them back here. Augusta Health is the largest employer in the area. We employ over 2,100 employees. But without Medicaid expansion or private market-based alternative, then we have to start making decisions with regard to compensation and staffing, which have adverse consequences for the community. We have a responsibility to care for all the citizens in the community. We don't have a choice to choose to only serve some. We serve everybody. And we also have no choice about opting in or out of the cuts that we're receiving under the Affordable Care Act. But the legislators have an opportunity to opt into a system which better provides for the needs of patients who are our neighbors, as well as helping to sustain our hospital to continue to provide good care for all going into the future as a community-owned institution. Medicaid isn't a magic bullet in all this. We currently lose about 40 cents on every dollar that we spend on Medicaid patients, but we lose 100% of all those who don't have coverage. It's not going to be a bonanza to our bottom line, but what it will do is help us to remain community-owned and independent. We hope that our legislators will hear this, that they will consider the needs of folks within the state, the opportunity that they have to take dollars which are being paid to Washington, regardless of what action they take, and bring them back to Virginia to provide better care for our folks here. Because if that doesn't happen, we as citizens end up paying twice. We pay once to send the money which we're required to pay under the Affordable Care Act, and you will pay to sustain those folks within our system who don't otherwise have insurance, for whom we provide uncompensated care. It ends up being paid in higher rates. It ends up being paid in reduced services. It ends up being paid at a time when it need not be paid at all. If we can come together as a state, as a legislature, as citizens, and expand the coverage, because it's the right thing to do. Thank you.